thinking back, like this whole thing was like a miraculous chain of events, starting with the accident itself to, to Henning being on spot, the fire department, the ambulance, to getting into, the transport, to getting here, to getting to, then I was in St. Cloud. And then from St. Cloud, I was flighted to Mayo. Like the whole thing is just a miraculous chain of events. And if one of those links breaks down, it probably, it would have made the difference. I'm sure of that. So it's just like everything just lines up the way it needed to, but there was so much work to train those people and for those people to have the ability to do what needed to do, or needed to be done rather.
Here at Astera Health, we are very blessed to have the hospital support on our EMS education program. We do internal education, we do external education, all those different departments that we were talking about, we've had outreach with them to do training, right? We run at least 2 EMT programs a year, multiple first responder or EMR programs, and we service all of these departments in a local and kind of regional sense with training that goes from CPR all the way through different core skills for the job. So without something like that in place, it's another thing that would collapse the system. You wouldn't have people that would be able to sustain the training requirements that are out there, because they're the same for volunteers as they are for full-time people.
So if I'm ever in an accident again, which I hope I'm not, but if I am, or that next person, when our volunteer firemen, EMS, ambulance service, first responders, when they roll up in towns like Henning or in any town around here, you need their training to kick in. And like that is as vital as anything. I can just tell, like in having conversations with them, how knowledgeable they are and how vital that training is. And because that's what's going to make the difference right there.
The time that's involved in the training that we do now is it's extensive, and you're not compensated for that as a volunteer. But it's moments like these, like the importance of being part of this picture. Like, just think if you didn't have Henning Ambulance or Henning Fire or anybody there to first respond, to get that initial patient contact and get you rolling, get you going in that direction. Like you said, Andy, did you have minutes, hours? You don't know. You just know that you felt yourself fading. So it's so important. And even how Chelsea mentions that she's just a small pebble in this big success story, but it's a very important pebble that people don't understand, that how important it is to have those services in your community.